Portuguese. So you can choose. World Health Day theme today is mainly a call for action to improve health and well-being, prevent avoidable causes of disease and death by protecting the environment. Let us remind ourselves that the COVID-19 pandemic has highlighted the fault lines of inequity across the world, underlying the urgency for creating sustainable well-being societies which do not breach ecological limits and which ensure that all people have access to life-saving and life-enhancing tools, systems, policies, and environments. The World Health Day reminds us that this environmental crisis of climate change and pollution is a serious public health problem. But also another serious problem is access to water and sanitation, chemicals that can harm our people. Let us also remind you that PAHO and WHO are the custodians of many SDGs, of Sustainable Development Goals. I have asked Harold to help me with one slide that I want to show you to set the tone of this event. Harold, please. What you see here, it's in the center, SDG 3, good health and well-being, ensure healthy life and promote well-being for all at all ages. And this is surrounded by 5 key SDGs that interact with health and determine actions and policies that we need to implement to tackle them. SDG 6, clean water and sanitation. SDG 7, affordable and clean energy. When we talk about fossils, burners and fuels. SDG 13, climate action. And we don't need to tell you about hurricanes, landslide, floods, and so on. SDG 12 and SDG 11. So all very interconnected with health. So the bottom line is, in order for us to achieve SDG 3, we also need to tackle these pressing environmental public health problems. Thank you, Harold, for this slide. And for that today, the Pan American Health Organization, we have a stellar lineup of speakers that will address you, will share with you best practices, and will tell you the way forward on innovation, like, for instance, the One Health, that it's a recent policy created by the Pan American Health Organization to promote collaboration and make sure environmental determinants are addressed in an intersectoral, interprogrammatic way. Our agenda today, it's headed by Dr. Carissa Etienne, Director of the Pan American Health Organization. We welcome also Dr. Jacqueline Alvarez, Director of the Latin American and the Caribbean UN Environmental Programs, UNEP, and 3 wonderful honorable ministers, Dr. Jose Manuel Mateo, Secretary of Health of Honduras, Dr. Carla Bisotti, Minister of Health, Argentina, Dr. Christopher Tufton, Minister of Health of Jamaica. We will close with words from our Assistant Directors, Dr. Jarbas Barbosa. So without further ado, let me again thank you all for coming in and listening, and let me give the floor to our Director, Dr. Etienne. Please, Dr. Etienne, the floor is yours.
Thank you, Marcos, for framing this engagement this morning. Let me greet Dr. Carla Bisotti, the Minister of Health of Argentina, Dr. Jose Manuel Mateo, the Secretary of Health of Honduras, Dr. Christopher Tufton, the Minister of Health and Wellness of Jamaica, Dr. Jacqueline Alvarez, Director Latin America and the Caribbean of the UNEP program. And let me also greet our PAHO and WHO colleagues, our honored guests, and really esteemed ladies and gentlemen. Good morning to you all. Over the last 2 years, we have lived through what are the devastating effects of the COVID-19 pandemic? Millions of lives have been lost, the world's economy severely disrupted, and our societies continue to grapple with the far-reaching and overwhelming consequences of COVID-19. Billions of people are still without reliable and affordable access to medical treatment and vaccines against COVID-19. The persistent inequity and the weakness and limitations of our health systems and the level of preparedness have been both exposed and exacerbated. And the COVID-19 pandemic has again reinforced the urgent and imperative need for universal health that is built on the foundational principles of primary healthcare and deeply rooted in a meaningful commitment to equitable policies, practices, and high quality care systems for all. We live in what has been termed the most inequitable region of the world, where wealth and social inequality are widespread, and where the greatest impact from COVID-19, other communicable and non-communicable diseases, is borne by those communities living in conditions of vulnerability. We've also learned that health must be urgently repositioned in all policies, and that an all-sector approach must be prioritized. The social and environmental determinants of health can only be successfully addressed through multi- and intersectoral engagement. One Health is a mechanism that aims to foster coordination and collaboration between the different frameworks of human, animal, plant, and environmental health to better prevent and prepare for current and future health threats at the human, animal, environmental interface. So the so-called triple planetary crisis of climate change, loss of biodiversity, and pollution is impacting the health of all people, as well as our people and the health of our planet. So those effects are amplified by deficiency in infrastructure and health systems to prevent disease and effectively respond to crises, disasters, and emergencies. Animal health and the health of our environment are inextricably linked with people's health, how we live, organize our societies, and produce and consume goods. Over the past 3 decades, we have witnessed concerted global action to build a sustainable planet. Since the UN Conference on Environment and Development, also known as the Rio 92, and more recently via the Millennium Development Goals and the current Sustainable Development Goals. During this period, we have seen some notable enhancements in health services and improvements in the health of peoples of the Americas. For example, intersectoral collaboration among the health, water, and sanitation sectors has reduced the mortality risk among children under 5 years from 219 to 23 deaths per 100,000 population. And that represents 1.8 million young lives saved since 1990. Nevertheless, every year in the Americas, an estimated 1 million premature deaths are attributable to non-avoidable environmental risks. Air pollution, contaminated water, inadequate sanitation, including solid waste management, risk related to certain hazardous chemicals, and adverse impacts related to climate change are the most pressing environmental public health threats for our region. It is unacceptable, really, that in the 21st century, approximately 431 million people in our region still do not have access to safe sanitation. And of this number, 9.9 million people still practice open defecation. 161 million people still do not have access to safe drinking water, resulting in about 30,000 preventable deaths each year. Household and ambient air pollution is linked to almost 320,000 preventable deaths per year in this region due to stroke, heart disease, lung disease, and cancer. Almost 80 million people still depend on polluting fuels, such as solid fuels or kerosene, to support their needs for lighting, cooking, and heating, a problem that disproportionately affects mostly women and children. People are still being exposed to hazardous chemicals, such as mercury, lead, and pesticides, which not only jeopardize the health of the persons that are directly exposed, but also that of the unborn children in utero, who can suffer ill effects throughout their lifespan. Extreme weather events can directly increase the prevalence of some diseases and cause injury and death. Additionally, changing climate patterns can modify human health by exacerbating food and water insecurity, population migration, and compromising mental health and altering the usual transmission patterns of zoonotic and waterborne diseases. Those living in poverty, in precarious housing conditions on small islands and coastal areas are at greater risk due to more frequent and severe weather events and rising sea levels coupled with a reduced ability to adapt. New environmental related hazards to health are increasingly being recognized. For example, exposure to substances in electronic waste, the environment and health effects of micro and nanoplastics, and increased antimicrobial resistance, only to name a few. To further address these challenges and to help our member states advance, PAHO last year launched the Agenda for the Americas on Health, Environment, and Climate Change 2021-2030. This agenda will benefit all countries and territories by promoting good governance practices, strengthening the leadership and coordination roles of the health sector, fostering cross-sectoral action, focusing on primary prevention, enhancing the generation and use of evidence, and improving communication to promote awareness and action. Today's World Health Day theme, Our Planet, Our Health, is a call not only for a green and healthy recovery from the COVID-19 pandemic, which places the health of individuals and the planet at the center of actions and fosters a movement to create societies focused on well-being, but it is also an emphatic appeal for extra transformative efforts to protect the health of the most vulnerable populations from environmental risk. We can do this. We can do this together. I wish to remind everyone that this year PAHO is proudly celebrating 120 years of providing solid and uninterrupted technical cooperation in public health to our member states. And one key observation which has emerged is that solidarity and cooperation have been preeminent among our region's greatest strengths for more than a century. So this is the time for member states to recommit to regional solidarity and to strengthen our individual and collective actions to better protect our health, that of the future and unborn generations, as well as the health of our planet. Really, the future depends on us, as we are not only the custodians of today, but the architects of tomorrow. And thank you again for joining us in this World Health Day event. Thanks.
Thank you very much, Director, Dr. Etienne, for your inspiring words and setting the tone and the way forward. Clear words that needs to be taken very seriously if we want to reach the 2030 agenda and tackle all these environmental threats that are affecting and impacting our health. La doctora Jacqueline Álvarez es la directora para Latinoamérica y el Caribe del Programa de Medio Ambiente de las Naciones Unidas. Y es fitting que esté con nosotros porque es time, porque tenemos un MOU. We have an MOU with UNEP. Así que le agradecemos su participación. Gracias por aceptar la invitación, doctora Álvarez, y el micrófono es suyo.
Muchísimas gracias por esta cálida bienvenida, doctor Marcos. Y para nosotros es un honor trabajar con ustedes en el ámbito global, en el ámbito regional, en el ámbito nacional. Es esencial esta coherencia en los trabajos de ustedes y nosotros. Voy a pasar al inglés. Y en principio, y antes de, quería saludar muy calurosamente a la doctora Carissa, al doctor José Manuel, a la doctora Carla, al doctor Christopher, por ser parte de este proceso y de este evento. So, colleagues, friends, what we have understood better over the last year is that environment matters to One Health more than ever. We heard that 50 years ago in the Stockholm conference, but now we have all the elements that we need to really strengthen this concept. At the 5th United Nations Environment Assembly, which concluded about a month ago, we heard a clarion call for investing in environment to solve development and health challenges. We heard a call for everyone to open their doors and work with a unified vision rather than going into fragmented agendas. The resolutions passed at UNEA by member states, it's ministers of environment, but at the end, it's member states that belongs to all of us. It made a very clear statement about the environment stakeholders, indicating that all of us are ready to work with the sectors and hope that these sectors, actors, will reciprocate. We need to really work together. I will highlight some of the results of the assembly because it really deals with environment, health, biodiversity. So there is a very important resolution for us, which we are calling the Paris for Plastics, which is a resolution to end the plastic pollution. And now we are starting to forge a legally binding agreement that by 2024 needs to be ready, the text of that. And it calls upon the full life cycle of plastics. Many of you have learned about plastics because of the marine environment and because of the pollution that it is there. But at the end, plastics is much more than that. We have seen very recently the presence of plastics, not only in the human gut, but also in the blood of humans. What does that mean? We still don't know, but we know as well that when things that are not supposed to be in a place are there, they might not be good. We had also a resolution on biodiversity and health, calling on member states to support the One Health approaches when dealing with national things and elements. It specifically asked UNEP to join the tripartite, and now we can really be very glad to announce that we are a quadripartite, if that's the name we are called. But what matters more is that we are working together and the pillars of One Health are really being addressed from the core. We also had a resolution on nature-based solutions to improve everything related to food security. Food and health is really critical, and that's an aspect that talks not only about the GDP of a country, but it talks about the quality of life for the people that live with us. We had also another very important resolution, which will be, in our understanding, a game changer, and that is a resolution on science, policy, and pollution, to establish a panel to discuss the elements of pollution, chemicals, and waste, the scientific finding, the science evidence-based knowledge, and connect with the policy makers. finally, in relation to UNEA, there was also a ministerial declaration recognizing the risk of future pandemics if humanity does not really learn how to interact with nature. And in here, I'd like to stress what Dr. Carissa was saying on the antimicrobial side of the things. And the pandemic is showing that in a big scale situation with all the unfortunate deaths that we are facing. UNEA sent a very clear message: a healthy environment equals healthy people, healthy animals. So in a way, we cannot divorce the measures that we do. We have also another important example, and maybe going some years back, which is the Minamata Convention on Mercury. And at that moment, and as you know, the Minamata Convention is a multilateral environment agreement. But what makes a huge difference is that it has an Article 16, which is called health aspects. And in there, it is very strongly recognized the importance of promoting, implementing strategies, programs to identify, protect populations at risk, particularly vulnerable populations. But it also refers to the science-based health guidelines related to exposure to mercury and mercury compounds. So, and that happened some years ago, a decade ago, practically, that this text was adopted. So we know very well the things. I would also like to delve a little deeper into the pollution issue, which is critical in the context of One Health. You have heard, and all of you know these numbers by heart, but I keep on repeating them because they are overwhelming. 7 million people pass away earlier each year because of air pollution. Hello, that's the double of the country I was born, the double of the population of the country I was born. So twice that level of population is dying. So my country will be phased out of the world every 6 months. Dirty air also damages more than that. It increases also severely the mental illnesses, all the mental health related aspects. And 99% of the global population are breathing air that exceeds the WHO guidelines. The scale of the threat is really, really huge. Water pollution, what can I say? It kills. We all know that. And we know that people die, millions of people die each year of diarrhea from contaminated water, chemicals in our environment. 1 out of 3 children have lead in their blood at levels that might be associated with decreased intelligence, behavioral difficulties, learning problems. Yeah, lead is part of our earth, but we are not managing it in the correct manner. There is a huge cost to natural systems as well. And at the end, the human existence is in jeopardy. Untreated waste, pollutants from industry, mining. What can I say about mining in this region? You know it very well. Agricultural activities, oil spills. We have had one not that long ago in Peru. Toxic dumps destroying our habitats. Colleagues, we have a lot of work to do. Plastic pollution treaty can be, we hope it is a game changer. Also, you have heard these numbers, but 7 billion of estimated tons of plastics produced, 9.2 out of that are being dumped, are waste. It's too much. In our region, we bring into the environment 17,000 tons of plastic waste every day. Imagine those numbers. How many vans, how many cars, how many infrastructure needs to be put together to get into 17,000 tons. With this waste comes health risks. you know, fertility, you know, hormones. Plastics are not only products that we use. Plastics contains additives, contains chemicals, and some of them have been proved to be persistent organic pollutants. The Stockholm Convention enters into force here. Plastics are also related to greenhouse gas emissions. That is, of course, associated with the production side of the plastics, but also to the use and the disposal. We need to reach the 1.5 for all. And this is one of the elements that we always need to bear in mind. I present this picture really not to be a doomsayer, but to point out that we have the chance to really change the game. And that will bring economic benefits. It will bring social benefits. It will bring behavioral consequences that we really need to deal with. Getting it right could also create a model to move into a more circularity in sectors, for us as consumers to learn how to choose things in a best manner. What works for, and I will repeat again, plastics can be used for energy, for transport, for construction, for creating jobs, for mitigating the triple planetary crisis that was also mentioned at the beginning by Dr. Carissa. And of course, that is improving our health, the One Health, for the planet and for ourselves. At this time, when our planet is growing sicker, people and animals are also getting sick with it. We need to work in this quadripartite alliance on One Health. That is of extreme significance and importance for UNEP. We saw a revised definition of One Health with the support of the One Health high-level expert panel, and we are very happy with that. In the meanwhile, we have prepared a report which is called Environmental Dimensions of Antimicrobial Resistance, and 5 main sources have been identified. It is sometimes hard to get the connection, and in this arena, practically the health of the people and the animals were at the center, but we know now that without dealing the transmission, the spread of antimicrobials in the environment, we are committing future suicide. What is apparent to
Dr.
everyone?
Alvarez, I'm afraid we have 1 more minute. Yeah.
Oh, okay. I'm very sorry for that. So we'll be closing. But
Yeah.
UNEP is really pleased to be working with PAHU through the Joint Action Plan to serve better countries in an integrated manner, environment and health. I'm very sorry for the long speech.
No. I just want to make sure all of you have the opportunity to, but very scary numbers you gave us, and 7 billion plastics. So really, we need to act now. So, and we look forward to continue working with you. We have a memorandum of understanding. And indeed, as you said, we are the quadripartite now. 2 weeks ago, 3 weeks ago, Dr. Tedros welcomed UNEP formally into the alliance with FAO and OIE. So I think it's excellent news that we can continue working together. And you mentioned One Health, which is an innovative approach that could address not only zoonotic diseases, AMR, environmental determinants, food safety, and others. So I thank you kindly and apologize for reminding, but thank you for coming with us. Let me now switch to Spanish and darle la bienvenida al doctor José Manuel Mateu, secretario de Salud de Honduras. Estamos muy contentos ya que Honduras acaba de inaugurar un nuevo gobierno y queremos felicitar al doctor José Manuel Mateu en sus nuevas funciones como secretario de Salud. Sabemos que le esperan desafíos, pero sabemos también que tiene toda la energía para afrontarlos y llevar a la gente de Honduras a una mejoría en su salud. Doctor Mateu, bienvenido. El micrófono es suyo.
Muy buenos días, buenas tardes. Es un placer para mí estar hoy aquí con ustedes. El mundo está cambiando. En mi país tenemos por vez primera una mujer presidente. Y hoy me toca hablar después de dos mujeres, la doctora Etienne, la doctora Álvarez. Un placer para mí saludarles, saludar a nuestros compañeros ministros y ministras, al señor subdirector de la OPS, el doctor Barbosa, a todas las damas y caballeros que están hoy aquí escuchándonos. La salud y el bienestar de todos están estrechamente vinculados con el medio ambiente que nos rodea. Es un círculo virtuoso en el que las conductas individuales, colectivas, las políticas de Estado y el qué hacer empresarial potencian un desarrollo responsable, repercuten en una mejor salud de los individuos y de la comunidad, al mismo tiempo que propician la sostenibilidad del planeta, el único que tenemos. El tema de este Día Mundial de la Salud, nuestro planeta, nuestra salud, una frase tan cortita así, pero que significa tanto. Es el único planeta al que debemos querer y cuidar. Afirma esta condición a la cual Honduras no es ajena. Vamos en este momento a plantear lo que nuestro gobierno, un gobierno que acaba de reformular el presupuesto dirigido ahora hacia el ser humano. Anoche, hoy en la madrugada, acabamos de aprobar un aumento de $100 millones para el presupuesto de salud, porque este es un gobierno con rostro humano. Estamos conscientes de las limitaciones que hay en materia de salud en todos nuestros países y en el nuestro en particular. Estamos conscientes del daño que se ocasiona en la salud de las personas al no tener adecuadas condiciones en el entorno familiar. El uso de biomasa, de combustibles que están generando un aumento de las enfermedades respiratorias crónicas, del asma. Hemos revisado cifras de las muertes en nuestro país de pacientes con enfermedad pulmonar obstructiva crónica, de ver que son sobre todo niños, mujeres y las personas de mayor edad los afectados. Esto nos ha hecho como gobierno tomar decisiones y en breve estaremos firmando junto con los ministros del Ambiente y de Energía un convenio que nos hará tomar un rumbo diferente hacia la atención que daremos a nuestra población. El mundo está cambiando, pero debe de cambiar para mejor. No podemos seguir permitiendo que el futuro de nuestro mundo, nuestros hijos, nuestras nietas, vaya cada día hacia atrás. El humo de la combustión de biomasa afecta a toda la población, pero como lo mencioné anteriormente, en nuestro país, a esa población más desposeída. Quiero reiterar hoy que nuestro país está comprometido ahora más que nunca con el bienestar humano. Estamos con un porcentaje inaceptable, estimado en 1.120.000 hogares que dependen de la leña para cocinar, sobre todo en el área rural, pero también en el área urbana. Es decir, más de 5 millones de personas de nuestra población, el 55% de la población que están expuestas al humo de la combustión de biomasa. Ya habíamos mencionado, sobre todo las mujeres, los niños y las personas mayores. Según un estudio del Banco Mundial, ya un tanto viejo, del 2007, los costos anuales del sistema de salud en Honduras, asociados con los riesgos ambientales, ascienden a casi 4.000 millones de lempiras por año, es decir, unos $200 millones. En primer lugar, los costos más altos provienen del suministro de agua, el saneamiento de higiene inadecuada, que ascienden a más de $91,5 millones, seguido de la contaminación del aire interior por combustibles sólidos, que afecta principalmente a la población rural, aunque continúa teniendo un impacto importante en la población urbana, con un costo estimado de más de $56 millones al año. Los costos de la contaminación del aire urbano suman $48,5 millones. Debido a sus exposiciones diferenciadas y sus susceptibilidades más altas a las infecciones, los niños se ven afectados de manera desproporcionada por los riesgos ambientales para la salud. En general, el 50% de los costos anuales ejercidos por el sector público de la salud fueron aquellos relacionados a riesgos para la salud de los niños menores de 5 años. En términos de factores de riesgo ambientales específicos, alrededor del 22% de la mortalidad infantil de menores de 5 años se atribuye al suministro de agua, saneamiento e higiene inadecuados y a la contaminación del aire interior, mientras que alrededor del 3% de la mortalidad de adultos se atribuye a la contaminación del aire interior y exterior. Es en función de estos indicadores que estamos tomando la decisión como gobierno, pues la salud es la máxima expresión del bienestar humano. Y para este gobierno, la persona humana, el ser humano, es la prioridad. Como salud, somos el termómetro del desarrollo de un país. La Organización Mundial de la Salud ha estimado que en el 2016 se registraron 2.269 muertos por uso de combustibles sólidos. 8 correspondieron lamentablemente a menores de 5 años. Si sumamos el claro e imparable daño a la salud, las consecuencias que suman el empobrecimiento de la población, las horas laborales perdidas por recolección de leña y el impacto en el medio ambiente, el tema del uso de combustibles sólidos se convierte en un tema toral para las políticas de Estado. El plantear ahora un esfuerzo de Estado para migrar de combustibles de biomasa a combustibles más sanos en el hogar es una tarea que llama al trabajo intersectorial e interinstitucional. Por eso, en el evento nacional de la celebración
I think we lost him.
de ruta para proponer soluciones intersectoriales factibles y de alto impacto. Además, desde la perspectiva de la Secretaría de Salud, impulsaremos la iniciativa de hospitales seguros, resilientes y verdes para mejorar la infraestructura hospitalaria. Ya tenemos un hospital sostenible, nuestro Instituto Nacional Cardiopulmonar. Esto le va a generar ahorro al Estado, pero por vez primera además le estamos dando agua tibia, agua caliente a las pacientes para que se puedan bañar con ello. Este Instituto Nacional Cardiopulmonar es el modelo de hospital verde, pero vamos ya con otro. En estos primeros 3 meses de gobierno, el planteamiento del gobierno actual, encabezado por nuestra primera presidenta, Xiomara Castro Sarmiento, para dar forma a políticas que mejoren el bienestar de nuestra población, implica adoptar políticas estatales a muchos niveles. Por una parte, en cuanto al acceso a combustibles más limpios y sanos, promoviendo políticas enfocadas a sectores urbanos marginales y de manera paulatina sectores rurales, promoviendo alianzas público-privadas que logren alcanzar tecnologías más limpias, como son estufas mejoradas, estimulando una transición que lleve a las y los hondureños de los tradicionales ecofogones de leña al uso de energías más limpias y menos dañinas para la salud. El involucramiento de diversos sectores del gobierno en todos los niveles de la toma de decisión para la construcción de políticas públicas que construyan grandes marcos y regulaciones que busquen soluciones al uso de combustibles más sanos para cocinar y que tengan un mejor impacto en mejorar la salud de la población afectada. Es una prioridad para esta administración. Por eso, en este Día Mundial de la Salud, que nos da la oportunidad de unir los conceptos de nuestro planeta con nuestra salud, debemos aprovechar la fortaleza del sector salud como un elemento aglutinador en temas ambientales que otorga el perfil humano a la toma de decisiones en las políticas y regulaciones ambientales de energía, y claro está, en la salud. La presidenta Xiomara Castro, en su plan de gobierno, plantea varios ejes para el abordaje de la pobreza, siendo su principal expresión la salud de la población como un eje transversal. Salud que se construye tanto con la prevención de las enfermedades, el acceso a los servicios de salud adecuados y elevando la calidad de vida por medio del acceso al bienestar en el hogar, para lo cual es fundamental la consecuente conservación de la riqueza, de la preciosa naturaleza de nuestra patria. Hoy se plantea la oportunidad para avanzar en un ambiente más sano, un ambiente sostenible y una salud para todos y todas donde quiera que estén. Gracias por escucharme y me tendré que retirar en breves minutos para participar en el evento regional que lo tenemos en la sala de al lado. Un placer estar con ustedes y de parte del gobierno de la primera mujer presidenta en Honduras, reciban un cordial saludo y el compromiso sincero que nuestro país esta vez sí tiene su enfoque en la persona humana y en la salud con calidad de todos. Muchas gracias.
Honorable ministro, muchas gracias. Felicitaciones por todo. Acaban de llegar y ya tienen una hoja de ruta para eliminar el uso de leñas en su país. Lo felicitamos, la OPS lo acompañará. Siempre de la mano estaremos con ustedes, nuestra representación en Honduras, al frente de la doctora Piedad Huerta. Así es que estamos para servirles con nuestra directora, la doctora Etienne. Les deseamos éxitos en sus funciones y entendemos perfectamente que tiene otro compromiso con un evento local y les deseamos éxitos a todos. Y esa intersectorialidad es lo importante para poder mejorar la salud de los niños y de las madres hondureñas. Felicitaciones, ministro, y muchas gracias. Ahora vamos a pasar a la honorable ministra de Salud de Argentina, la doctora Carla Bisotti, que todos conocemos y que una colaboradora amplia de la OPS, siempre apoyando nuestras iniciativas y al lado de la OPS. Argentina es un país que siempre ha apoyado a nuestra OPS y nosotros también acompañaremos y seguiremos acompañando a Argentina en esa lucha contra los determinantes ambientales en un país grande y federal. Honorable ministra, el micrófono es suyo.
Muy buenos días. Muchísimas gracias. Un gusto saludarte, Marcos, saludar a la directora, a todos los expositores, las expositoras, a quienes nos están escuchando. Estamos desde San Juan, una provincia de Cuyo, cerquita de Chile, con la ministra de Salud, por eso tenemos la bandera argentina, la bandera de San Juan. Le agradecemos el espacio para poder tener esta importantísima reunión, agradecerles haber invitado a Argentina a ser parte de este desafío que tenemos a nivel global y también como región y también en nuestro país. El Día Mundial de la Salud, pensarla como algo relevante en relación al ambiente, la salud, el cambio climático y nuestro planeta, nuestra salud es realmente importante. Nosotros, nosotras quienes hacemos salud, sabíamos que la salud era una prioridad, pero la pandemia puso realmente en dimensión lo que significa que el mundo no tenga salud, que haya una situación como la que hubo, no solamente desde el punto de vista sanitario, sino social, económico, productivo, laboral. Así que es una oportunidad enorme, es poder transformar una amenaza, una crisis en una oportunidad, dejar y sostener a la salud en el centro de la escena como algo transversal y muy necesario para poder generar todos los demás determinantes de la salud y también pensar en que la población se pueda empoderar de la salud como un derecho, no solamente cuando está amenazado, cuando se pierde, sino también y sobre todo sostenerla, promoverla y generar acciones preventivas. Y en ese sentido también venimos diciendo hace tiempo que la salud es una construcción colectiva, que son las personas, quienes les rodean, el entorno, y en eso tanto la directora de la OPS como la doctora Álvarez han comentado el problema global, el desafío que tenemos en el mundo y en nuestra región, como también se dijo, la más inequitativa, una de las que más impacto han tenido en relación a la pandemia, pero también la que más trabaja muy fuertemente para poder resolver esas situaciones, la que a pesar de las dificultades en el acceso a las vacunas, tenemos en América del Sur el porcentaje de vacunación más alto de los continentes, de las distintas áreas. Así que desde ese punto de vista tenemos dificultades, tenemos desafíos, pero también tenemos equipo de salud, tenemos decisión política y tenemos una mirada regional que nos hace tener la posibilidad de avanzar. Así que agradecer muchísimo el espacio, poder contarles cómo estamos trabajando en Argentina en relación a este tema. Es una prioridad muy importante de nivel presidencial, en la cual todos los ministerios están involucrados, y en Argentina tenemos un ministerio de Medio Ambiente con el que articulamos muy fuertemente. Ustedes saben que en 2019 se sancionó una ley, la Ley de Presupuestos Mínimos de Adaptación y Mitigación del Cambio Climático Global en Argentina, y se creó un Gabinete Nacional de Cambio Climático. Este gabinete tiene una función de articular las diferentes áreas del gobierno, por supuesto incluyendo al Ministerio de Salud de la Nación, para desarrollar e implementar un Plan Nacional de Adaptación y Mitigación del Cambio Climático. Hace pocas semanas el presidente lideró, encabezó ese gabinete que tiene reuniones periódicas y donde todas las áreas del Estado generan sus acciones y se coordinan. También contarles que desde 2008 nuestro Ministerio de Salud comenzó a trabajar en el tema de cambio climático y salud. Trabajamos en generar diagnósticos de situación, líneas de bases, investigaciones centradas en evaluar los impactos de los eventos meteorológicos extremos sobre la salud. Se generaron y se elaboraron normativas para todo el país, lo dijo Marcos. Argentina es un país muy extenso y es un país federal, así que el trabajo siempre es desde el Ministerio de Salud, trabajando en consenso con las jurisdicciones, en el marco del Consejo Federal de Salud, con sociedades científicas, con, por supuesto, la Organización Panamericana de la Salud, y con, basados en consensos y evidencias científicas, generar estas normativas, trabajar transfiriendo conocimientos y asistencia técnica, fundamentalmente desde el área de salud ambiental. Contarles también que en los últimos años, a pesar de la pandemia, se ha fortalecido la gobernanza del cambio climático al interior del Ministerio de Salud. Hemos, cuando asumimos en 2019, hecho un análisis interno de lo que se estaba haciendo desde el Ministerio, y ahí se creó el Programa Nacional de Reducción de Riesgos para la Salud asociados al cambio climático, se institucionalizó dentro del Ministerio de Salud con un rol articulador intraministerial e interministerial e intersectorial. Coordinamos una mesa de trabajo sobre salud y cambio climático, y por supuesto que este programa es quien representa al Ministerio de Salud en el gabinete. Se creó por resolución ministerial esta mesa, se formalizó una mesa de trabajo sobre cambio climático y salud dentro del Ministerio de Salud. En 2021 se formalizó. Son 10 áreas del Ministerio de Salud y es un espacio realmente importante de transversalización de la problemática de la variabilidad climática y el cambio climático en todas las políticas, los planes y los programas que llevamos adelante desde el Ministerio de Salud de la Nación, y estamos trabajando en ya terminar y empezar a implementar este Plan de Acción Nacional sobre la salud y cambio climático, y también la prevención de riesgos para la salud asociados a eventos meteorológicos extremos. Y también trabajando fuertemente en esta Estrategia Nacional de Salud y Cambio Climático, que actualiza y reemplaza el Plan de Acción 2019 y tiene por objeto disminuir la morbimortalidad asociada a la variabilidad climática, el cambio climático, a partir de medidas de promoción y protección de la salud, y también desarrollar un sistema de salud resiliente al clima, basado en la evidencia, con bajas emisiones. Y esta estrategia tiene 21 medidas, que son 14 de adaptación, 3 de mitigación y 4 transversales, e incorpora 5 enfoques transversales como abordaje por curso de vida, género, diversidad, gestión integral de riesgo y una transición justa y una salud. Así que desde ese punto de vista el objetivo es ambicioso, la mirada es integradora y es con perspectiva de género, de derechos humanos y mirada federal, así que desde ese punto de vista tenemos varios proyectos también. En 2020 nuestro ministerio presentó un proyecto para incrementar las capacidades del sector salud, fortalecer la coordinación de la acción climática en Argentina a nivel nacional y subnacional al Fondo Verde del Clima. Es la primera vez que este fondo le otorga financiamiento a un Ministerio de Salud, así que desde ese punto de vista el trabajo ha sido intenso y el orgullo grande también de haber conseguido el financiamiento. Es un proyecto de 12 meses que va a permitir fortalecer la gobernanza del cambio climático y la salud en la escala subnacional. Es muy relevante poder trabajar con las jurisdicciones, con pilotos en 3 provincias del país, donde se crearon mesas de cambio climático en los ministerios de salud provinciales, desarrollos de planes provinciales de salud y cambio climático, mejora de la vigilancia, la medición de la huella climática en 3 hospitales, estimación de los beneficios para la salud de medidas de mitigación, mejoras en el transporte, la calidad de aire, los espacios verdes, y también se desarrollarán proyectos para la obtención de nuevos financiamientos externos. Otro proyecto es una contribución determinada a nivel nacional ante la Convención del Marco de Naciones Unidas sobre Cambio Climático. Argentina ha sido precursora en incorporar la salud y su relación con el cambio climático como ejes rectores que guiarán este proyecto, y trabajando también muchísimo, que se nombró también en relación a lo que significa el sistema de alerta temprano por olas de calor y la salud de la mano del Servicio Meteorológico Nacional. Tenemos un vínculo muy, muy estrecho y trabajando también en relación a estos puntos. Contarles también que nosotros tenemos un hospital nacional, que es el hospital de referencia para salud y ambiente, con el objeto de trabajar en red con todo el país en relación a lo que significa el trabajo de los hospitales verdes, inteligentes y resilientes. El avance que se ha hecho es muy importante, y siendo un hospital nacional, para poder generar esta red de salud y ambiente para que llegue a todos los hospitales y centros de salud de nuestro país. Por lo tanto, seguramente hay muchas cosas más y por supuesto muchísimos desafíos, pero poniendo en dimensión la situación global que se ha comentado, y poniendo también en dimensión lo que algunos países de nuestra región estamos trabajando, y el rol de la Organización Panamericana de la Salud en poder darnos más fuerza como región, me parece que es muy, muy relevante. Así que si nos permiten, creo que tienen un video de 30 segundos donde habla justamente de cómo tenemos que seguir trabajando para que la salud sea más accesible, más efectiva y con una mirada bien integrada de lo que significa nuestro planeta y nuestra salud. Muchísimas gracias.
Muchas gracias, señora ministra, por sus excelentes palabras y el video. Como usted menciona, visión integradora de género, de que todo el mundo esté incluido, es muy importante en estas iniciativas. Y en efecto, el Fondo Verde otorga por primera vez a un país en todas las 6 regiones de la OMS, fue la primera donación que se hace para trabajar cambio climático y salud. Y tenemos también que el Fondo Verde también ha autorizado esto para los países del Caribe. Así que le agradecemos, señora ministra, esperamos se quede con nosotros para un poco la discusión, aunque sea 10 minutos. And last but not least, the Honorable Minister Tufton, who is a commoner, a frequent flyer in PAHO. He is always supporting PAHO, always with us, and always responding to our request for participating in these events. Minister, thank you very much for being such a trailblazer in your country, and being such a good friend of PAHO, and for your time. We know you are very busy, and we didn't want to leave you for the last, but certainly our ladies set the tone. So now it's the micro is yours for telling us about Jamaica and how your people are fighting climate change, environmental determinants, and their impact on health. Thank you, Minister. The floor is yours.
Thank you very much for those kind words, Ms. Master of Ceremonies, Dr. Espidon. Dr. Etienne, the director, Pan American Health Organization, or very good friend of Jamaica, as is of the hemisphere, Dr. Barbosa, Assistant Director of PAHO, Dr. Alvarez, Latin American and Caribbean UN Environmental Program, my colleague, Ministers of Health from Honduras, Argentina, ladies and gentlemen, good morning, or to you all. No more than ever, as is being said by the speakers before me, it is so vital for us to accelerate efforts to realize climate resilient health systems in the Caribbean, as indeed in the world. But given the looming climate crisis, we are particularly vulnerable in these parts of the world. Caribbean SIDS, or small island developing states, given their small size, struggling economies, and climate-dependent industries such as tourism, are especially vulnerable to climate impacts and threats. Caribbean SIDS have many of their critical infrastructure along the coast, making sea level rise and coastal erosion a particular challenge. Also, an estimated 70% of the population lives along the coastline, and trends in population growth and increasing demand for land in these areas are only expected to continue. Further, the geographical location of Caribbean SIDS make extreme weather events, the likes of which have been experienced over recent years, with hurricanes of up to Category 5, a clear and a very present danger to our inhabitants in these parts. Still, it is my considered view that the health impact of climate change make most compelling case for the comprehensive and collaborative push to achieve a climate resilient health system. We support PAHO's agenda for the Americas on health, environment, and climate change 2021-2030. The Health and Climate Change Country Profile Project forms the foundation of WHO's monitoring of national and global progress on health and climate change. Significant data on the Caribbean supports the need for more aggressive action. Among these things, climate change threatens to exacerbate today's health problems, to include injury and death due to extreme weather events, including flooding, respiratory illnesses associated with poor health quality due to the burning of fossil fuels, and increase in mosquito-borne diseases such as dengue due to heat impacts related to high temperature days. Also, high temperature days, when measured in some Caribbean islands, have shown increased numbers of ER visits, hospital admissions, and even deaths. There are, too, associated challenges of undermined water and food supplies infrastructure, health systems, and social protection systems, in addition to the long-term consequences for mental health and the displacement of entire populations. The recent experience of COVID-19, Chair, is indicative of the progress that can be made in our public health response, given the political will, the commitment to mobilizing the needed resources and collaboration involving the whole of society. We must apply the same approach to building climate resilient health systems in the Caribbean, where there is so much at stake should we fail to achieve transformational adaptation, mitigation, and recovery planning. Meanwhile, in the race to assure the population of the best possible health outcomes to safeguard continuity of care, even in a pandemic, Caribbean states such as Jamaica have made some important strides, which I think we must recognize, amplify, and use as best practices to continue to build. Acknowledging the need to increase resourcing the health systems to the WHO recommended 6% of GDP, Jamaica, for example, has embarked on a health system strengthening program reflecting an improved approach to public health. The program emphasizes resilience building and is to efficiently respond to emergent challenges from non-communicable diseases, organization and consolidation of integrated health system networks, and improvement in the management, quality, and efficiency of health services. We are implementing an information system for health that has capabilities to remote patient monitoring, e-prescription, and electronic health records. And these are designed to improve benefits that include collaborative care and cost control, as well as improvements in health infrastructure and the built environment. There are also improvements in human resources for health, including a development plan for upskilling, including the provision of mental health services, as well as the diversification of health service delivery modalities to increase access through telehealth and mobile services. Also, quickly in the plans, our investment in GIS technology to chart and geolocate the prevalence of disease and analyze real-time data on health determinants, an improved model for business health care and health services, such as private-public partnership for expanding infrastructure capacity of essential services, intensify investment in health promotion and prevention, improving health-seeking behaviors to reduce the impact of NCDs, including greater focus on air quality improvement measures. In closing, there is also the Power-Assisted Smart Health Care Facility partnership that are focused on improving hospital resilience, strengthening structural and operational aspects, and providing green technologies in Jamaica and other Caribbean SIDS. We must build on these gains, Chair, even as we look at other areas for scaling up investment in support of climate action and towards climate resilience in health, including waste management, transportation, and renewable energy solutions, in addition to an infrastructure resilience and information management system. For Caribbean SIDS, each island must take action, and we must take action together as a region to combat climate change. Thank you very much, Chair, for allowing my participation.
Thank you, Honorable Minister Tufton, for addressing us on how you are leading the way in making the health system of Jamaica more resilient and environmentally resilient. Congratulations. And as you know very well, PAHO will stand by you to continue supporting you and the people of Jamaica. Now, we have a few minutes. We are on time before the concluding remarks by Dr. Jarbas Barbosa. And this is the time for a couple of questions and so. And I see in the Q&A a couple of important questions, and I will ask Dr. Risotti and Dr. Tufton if they can react, if they want to react to those. There is a question from Martin Dropen that said, what is needed to accomplish a tobacco-like convention for the fossil fuel industry? This is a very tough one because we heard Minister of Honduras talking about, you know, coal and carbon and leña. Any reactions, honorable ministers?
Well, in Jamaica, if I may, Mr. Chair,
please.
We have started to encourage, incentivize, and motivate alternative fuel sources to fossil fuels. In the recent budget presentation, the Honorable Prime Minister announced the importation at reduced cost at the level of the customs duties for electric vehicles up to a certain number. And we will see more of that taking place, which means that persons over time, we anticipate and expect will adjust away from fossil fuels. We are also, and I think this is similar in the region and certainly in the Caribbean, promoting the use of energy sources like solar energy, which is becoming almost a standard feature in terms of, you know, residential accommodation, and in some instances, quite a few instances, commercial business energy supply sources. And even in the case of the standards that are established to monitor the use of fossil fuels, the motor vehicles on the road and the exhaust systems and so on, there are a review of those standards to ensure that we establish higher requirements. So I do believe that we are on a trajectory to expose the alternatives to fossil fuels, and the adjustment by the consumer, by the population, I think is taking place. And I think that will force the suppliers of fossil fuels, the users, to take better precaution in terms of standards, but also increase the choice for alternatives, which will enhance, I believe, our environment and the quality of the environment. Thank you.
Thank you very much for those words. Ministra Bisotti, ¿tiene alguna reacción? No me escucha, parece la ministra Bisotti.
Sí, escuchamos,
ya.
perfecto. Nosotros en Argentina, uno de los pocos indicadores que han mejorado en forma sostenida en relación a las enfermedades crónicas y a la encuesta nacional de factores de riesgo es el tabaquismo. Tenemos una disminución sostenida, necesitamos generar acciones para acelerar ese descenso y por supuesto que el marco legal es importante y estamos trabajando con el Congreso para poder generar acciones también integrales y globales en relación a esto, compartiendo las palabras del ministro en relación a lo que significa las acciones que deberíamos implementar. Así que en ese sentido, poco para complementar. Gracias.
Muchas gracias, ministra. There is another question, important one, and because we might have to close for time, but I want to refer to this one is from our good friend who is a son of PAHO, Luis Augusto Galbao, Guto, who is connected. And Guto is saying, good morning, excelente evento. Los ministros de salud de las Américas han sido los primeros en aprobar resoluciones sobre el tema de este Día Mundial, como cambio climático, agua y saneamiento, seguridad humana, determinantes sociales y otros. Argentina ha ofrecido liderazgo en promoción de la salud, salud urbana, cambio climático. Como la comunidad académica podría apoyar la implementación de esta agenda global, en particular a Argentina como representante de la región en el comité de la OMS. No sé si tiene alguna reacción, señora ministra.
Sí, es fundamental. Nosotros desde el Ministerio de Salud estamos trabajando tanto con la sociedad civil en todos los aspectos, en todos los programas, en todas las áreas, como actores fundamentales para la gestión de los distintos desafíos, y con el área académica, las sociedades científicas. De hecho, hay un foro que tiene más de 50 sociedades científicas, universidades, asociaciones de pacientes y organizaciones sociales o civiles que tiene un vínculo muy cercano al ministerio, que es muy interdisciplinaria y que ha tanto apoyado iniciativas del Estado Nacional como propuesto acciones o generado también observaciones en función de las acciones. El rol de la academia, de las sociedades científicas, su involucramiento en las políticas sanitarias, que no tienen que ser vistas como políticas de algún partido político, porque la salud trasciende los partidos políticos, se construye con decisiones políticas, pero una vez que se generan los consensos debe trascender los partidos políticos, y la sociedad civil y la academia son fundamentales para que eso tenga más transparencia, genere más confianza en la sociedad y tenga mejores resultados.
Muchas gracias, señora ministra. Y el mensaje muy claro, es todos los sectores, es all government approach, all society approach. Tenemos que trabajar todos hacia eso. Bueno, lamentablemente no tenemos más tiempo, pero agradecemos las dos preguntas y queremos concluir, last but not least, con nuestro subdirector, el doctor Jarbas Barbosa, que tiene unas palabras de cierre para concluir este evento. Así que agradezco la presencia y la espera del doctor Barbosa y le paso el micrófono. Doctor Barbosa.
Thank you, Marcos. Good morning, dear Director, Dr. Carissa Etienne, Honorable Ministers, Minister José Manuel Mateu, de Honduras, Minister Carla Bisotti, de Argentina, e Minister Christopher Tufton, de Jamaica, honored guests and esteemed colleagues, Dr. Jacqueline Alvarez, Director of the Latin America and the Caribbean of the United Nations Environment Program. We heard today inspiring stories and experiences from the honorable ministers of Argentina, Honduras, and Jamaica about how they are leading the way in protecting human and environmental health from the challenges posed by climate change, air, water, and soil pollution, and how they are building greener and healthier societies for a better future of their people. We also heard from the United Nations Environment Program, UNEP, and PAHO, on how we can together deliver better technical cooperation and norms to our member states in the areas of air quality, water sanitation and hygiene, chemical and waste management, climate change, emergency and risk reduction, and ecosystem assessment. These areas of work constitute the basis of the joint Memorandum of Understanding of UNEP and PAHO signed in 2018. Ladies and gentlemen, collectively we are stronger, we can move faster, and we can go further to reach people living in situations of high vulnerability, like we learned from Honduras, protecting the health of population from island states, like we heard from Jamaica, and act in a concerted way to prevent health effects from climate change and other environmental determinants of health, as we learned from Argentina. Under the leadership of Dr. Etienne, PAHO's contribution to ensure our countries move forward includes key normative documents such as the Elimination Initiative Policy, approved at the Organization 57 Direct Council on September 2019, that includes 2 environmental conditions that can be eliminated from the region. The One Health Policy, approved at the Organization 59 Direct Council on September 2021, and the Agenda for the Americas on Health, Environment, and Climate Change, launched at a webinar with member states on 9 December 2021, which is our flagship document to support our countries to lead the way. We are also opening funding opportunities for our member states, like the European Union CARIFORUM project in the Caribbean and the Green Climate Fund project in Argentina, and many other initiatives and actions in our effort to collaborate to find the multi-sector and interprogrammatic solutions to these complex problems. The last 2 years have been very challenging globally and for our region of the Americas. The COVID-19 pandemic has shown the great resilience of our region and how we can move quickly to protect our people. The pandemic has also taught us critical lessons, such as the need to strengthen our health systems and make them environmentally resilient. World Health Day is always an opportunity for us to meditate and work together for a better, greener, and healthier future for all. If we are to reach the Sustainable Development Goals, and we are committed to reach them, we need to make sure we pay critical attention to the environment and social determinants of health in a more interagency, intersectoral, and interprogrammatic way. Thank you to our excellent speakers for the productive and informative session we had today to commemorate the 2022 World Health Day, Our Planet, Our Health. Thank you.
Thank you, Dr. Barbosa, and for your inspiring words. And that will conclude the event of World Health Day today. I thank our panelists, Dr. Etienne, Dr. Alvarez, and the 3 honorable ministers, Dr. Matteo Bisotti, and Dr. Tufton, and Dr. Barbosa. And thank you for your questions and answers. And certainly, this is a reflection for us to take forward and work together, all of us, to make sure we tackle those environmental threats. I thank you all. Goodbye for now.